Let's move on to projective tests. These projective tests are based on psychoanalytic theories of the unconscious and unconscious drives. Freud and other psychodynamic theorists emphasize the importance of the unconscious factors in understanding behavior. In fact, Freud compared the mind to an iceberg, and that the part of the mind that was the subconscious and the unconscious was the larger part that was invisible under the water, a little bit like an iceberg. What does this mean in regards to structured tests like the NEO-PI and the MMPI-2? Well, by definition, people are unaware of the unconscious dynamics, so they cannot report them to interviewers or on self-report tests like the NEO-PI or the MMPI-2. Thus, we need other methods to assess them. This is where projective tests come into play. Projective tests present participants with ambiguous stimuli and ask for some interpretation of them. So the sort of question that arises in projective tests is quite unstructured, and it's often started with the question of, what do you associate with this? Or what comes to your mind when you look at this picture? So here's an assumption. When somebody is shown a projective test, the individual imposes a structure on the unstructured stimuli, and in doing so, they reveal their unconscious desires, their unconscious fears, their unconscious needs, or their hidden impulses. The two main projective tests are firstly the Rorschach test, which looks at associations, and the thematic apperception test, which looks at how people construct stimuli. The Rorschach test, or the Rorschach inkblot test, was developed by the Swiss psychiatrist Hermann Rorschach, and it has the person view 10 inkblots. Each inkblot is bilaterally symmetrical. 5 of the inkblots are black and white, and 5 are in colour. The Rorschach inkblot test is a common measure of personality, being used roughly 6 million times a year. In the Rorschach inkblot test, respondents are asked to look at each inkblot and say what it resembles. Examiners then score their answers for numerous characteristics supposedly associated with those personality traits. For example, people who focus on tiny details in the inkblots presumably have many obsessive-compulsive tendencies. Have a look at this image and consider what this image resembles. If people respond that the top middle part looks like a pair of lungs, so in other words, they say it looks like a pair of something, then a typical interpretation may be of self-centeredness. If the participant responds in a space response, for example, that the white area in the lower middle looks like an upside-down bat, then a typical interpretation may be of rebelliousness or anger. Or if there's a human movement response, for example, the sides of the blot look like a person raising his hands, a typical interpretation may be around impulse control and inhibition. Despite this test being used over 6 million times a year, the test is scientifically controversial. The test-retest reliabilities are problematic. Even though psychologists use the Rorschach inkblot for assisting in making diagnosis, there is little evidence that it validly detects the features of mental disorders. It also does not appear to score high on incremental validity. What this means is that the inkblot test doesn't give any extra information than what other tests like the MMPI would provide, which is problematic given that it takes 45 minutes to administer and about 1.5 to 2 hours to interpret. Certain people have attempted to develop consistent scoring standards, but unfortunately for these sorts of tests there's no or little validity that they're actually measuring what they say they're actually measuring. The thematic apperception test, or the TAT, involves looking at a series of cards that depict ambiguous situations, most of them of an interpersonal nature. The examiner presents a card. So, for example, in this example, a boy is sitting at a table looking at a violin place on the table in front of him. The participant then tells a tale or a story based on each card. Scores from the TAT often do not generate adequate reliability or validity and often fail to distinguish psychiatric patients, such as people with clinical depression, from non-patients. Neither do they correlate in predicted directions with personality traits. So in summary, personality measurement or assessment is used to assist in prediction. For example, at work, how well we're going to go at work or how well we fit in at work. It can use different sources of information and it can be presented in different formats. Third, even well-validated tests rely on honesty and insight. And fourth, projective tests are still questionable in terms of their validity.